Alright everyone, in this video I want to talk about when is the proper time in the sequence of your treatment to do a tongue tie release, and I also want to make a comment on a lip tie release, which is something that often goes hand in hand with the tongue tie release, but as we will discuss, doesn't necessarily have to and probably maybe shouldn't. So let's dive right into it. Twice today I got the question in chats that I did. I mention this frequently, but I offer one-on-one chats. Link in the description below. I serve as a patient advocate for anyone seeking treatment in the jaw hacking world who's trying to navigate the very treacherous terrain of jaw hacking healthcare. You can sign up below. Anyway, today I had a couple of chats, and in two of those chats came up the question, when should I do my tongue tie release? The answer is always do the tongue tie release at the end. It's one of the last things you do along with any soft tissue nasal surgery. Tongue tie release happens at the end. Okay? Why is that? First of all, what is a tongue tie release? Tongue tie release is when they cut or laser release under your tongue, which is called the frenum. It's the soft tissue that connects the tongue to the floor of your mouth or to your lower jaw. And for a lot of us who have underdeveloped facial structure, the frenum is too far forward, which is hindering the range of motion of your tongue. So what they do is they take a laser, like basically a little handheld lightsaber, and they cut back the tissue that's under your tongue to give your tongue a better range of motion. It's interesting because do we have tongue ties because we're underdeveloped, or does our tongue tie cause us to be underdeveloped? Because of course, the tongue is the body's natural palate expander, and from infancy, if you're tongue tied, well, how is your tongue going to have the range of motion needed to go up onto the roof of your mouth and guide the growth of your facial bones forward? It can't. So a lot of times the people that I talk to who have craniofacial dystrophy, who have underdeveloped faces, they also have a tongue tie. Is it the chicken before the egg or the egg before the chicken? You tell me. But tongue tie release and MSE expansion or other types of expansion, tongue tie release is often part of the package of treatment that patients are prescribed by orthodontists or surgeons. So I'm often asked, well, at what point in the treatment should you do the tongue tie release? And the answer is after you do all expansion. Why is that? It all has to do with recovery from tongue tie release. Tongue tie release recovery is critical. Okay, and it's so critical that oftentimes a dentist will not even give you a tongue tie release unless you are working with an orofacial myofunctional therapist, which for all intents and purposes is a personal mewing coach. Okay, orofacial myofunctional therapy and mewing are the same thing. They both seek to improve our form and function of the face, the lips, the tongue, the swallowing patterns, the lip seal, chewing. It's just that a myofunctional therapist is a one-on-one coach who will walk you through specific exercises that can help you develop that function. And when you're signing up for a tongue tie release, the dentist who's going to be doing that release will often have you work with a myofunctional therapist to prepare for your release. And then you'll have to work with the myofunctional therapist after the release for a few weeks to do the daily exercises that are required to help you recover properly from the tongue tie release. Why is that? Because it's possible after you have a tongue tie release to heal into a position that's worse than the position that you started in. Let's think about this for a second. If they laser underneath your tongue, that wound has to heal. Well, if your tongue is in a constant state of resting after you cut that frenum, it could heal into a position that's shorter than it was when you did the release. So, scary, I know, because tongue tie releases are so damn painful, to think that you might heal in a position that's worse than where you started and that you might need to do a second tongue tie release, trust me, after you have that first tongue tie release and you feel that throbbing pain in the floor of your mouth, it's horrible. The last thing you're going to want is to have to deal with that twice. And so you want to make sure that after the tongue tie release, you work with your myofunctional therapist or you work with yourself for 2 to 4 weeks after the release, at least. Pretty much all day, every day, at least 5 to 10 times a day. You got to stretch your tongue. You got to do exercises that keep your tongue long, that help your tongue heal in an elongated position. Well, what is useful in that situation? Oral volume, of course. And that's why you do tongue tie release at the end of expansion, because you want to have as much oral volume as possible when you are recovering from your tongue tie release. So you do your expansion, your MSE. You gain that oral real estate. You remove the MSE. You remove any other metal from the inside of your, from the lingual side, let's say, of your teeth. It's okay if you have braces on or Invisalign even, but there should be nothing on the inside of your teeth or on the roof of your mouth. Then you do the tongue tie release. So people might counter, wouldn't it be beneficial to do it first so that you can have that increased range of motion of your tongue to help aid the expansion? I would say a few things. I would say, number one, your tongue is not doing your expansion for you when you're in an MSE or similar treatment. The appliance is doing the expansion for you. So this is actually a special window of time where you really don't need your tongue as much as you otherwise would. I think it's still helpful to mew through MSE treatment, and I did, but it's not critical. The appliance is expanding for you. So it's okay if you don't have 100% range of motion of the tongue at that time. And chances are you've already been mewing. If you found this channel, you've already been mewing anyway with your restricted tongue, so just keep doing that. Okay, you've come 20 or 30 or 40 or 50 or 60 years already with your tongue tied. Another 1 or 2 years while you wait to gain this expansion is not going to be the end of the world. So there's that consideration. I would like to make a comment about lip tie release now and on the dangers of upper lip tie release. So a lot of times doctors who offer tongue tie release, they want to hit your upper lip at the same time. Basically, this area in here, right in here, can often be tied as well. And so the doctor wants to hit that with the laser too. Here's where that can go wrong. If the doctor cuts too deep into one side of the lip as opposed to the other, you could end up in a situation where your smile becomes uneven. Why is that? Because when you go like this, one side of your lip that was released more deeply than the other, that side of your lip is going to get lifted more when you smile because there's going to be less tissue there. I believe this actually happened to me when my lip tie was released a long time ago. And so I caution people, don't do the lip tie release unless you absolutely have to, unless it's so severe that it's coming down basically to the bottom of your gums of your upper front teeth, because there is a risk of things getting worse before they get better. Not to mention the additional cost and the additional pain that's associated with releasing that upper lip as well. Danger to the smile from upper lip tie release. Only do it if absolutely necessary. So that's it for this video. Tongue tie release should happen after you expand, not before. That's the proper sequence of events. I will make one last comment about nasal surgery because it's very similar to tongue tie release. It happens at the end. And with the caveat of nasal surgery being that you don't want to do nasal surgery before you do MSE for a few reasons. Or double jaw surgery. You don't want to do nasal surgery before double jaw surgery or MSE for a few reasons. Number one, it's possible that the MSE negates the need to even do the nasal surgery. It's possible that MSE will fix your nasal breathing issues by expanding the roof of your mouth, which is also the floor of your nose. And so by doing the MSC, you're increasing your nasal volume, possibly making a soft tissue nasal surgery unnecessary. The second thing is that MSC and double jaw surgery in affecting the maxilla and in affecting the maxillary bone can actually create changes in your nasal cavity, and they can actually move the soft tissue. So I recently spoke with someone who had double jaw surgery, and the double jaw surgery actually made one of their nostrils worse. Okay, so whereas before there was no blockage in that nostril, now there's blockage in the right nostril of this individual. And so this person was explaining to me that he was going to be going in for a nasal surgery soon to fix that nostril, and that what had actually happened was that the double jaw surgery had created that problem. By moving his maxilla forward through the Lefort portion of the double jaw surgery, he had actually moved the inner structures of the nose into an arrangement that created a blockage. So nasal surgery, like tongue tie release, is a ribbon on the wrapped gift. It's an icing on the cake. It's something you do at the end, okay? And I would say the same as well for a cosmetic nose job as well. You don't want to shape your nose until you know what the rest of your jaws look like. So any kind of surgery on the nose, any kind of surgery on the soft tissue of the nose happens absolutely at the end of any maxillary expansion that you're going to do. All right, for real now, that's it for this video. Hope you enjoyed it. Hope that answers questions. Don't forget to like and subscribe to the channel. Like the video, subscribe to the channel, and I appreciate your support, and I will talk to y'all next week. All right, be easy. Peace out.